The situation in the Polish healthcare system is so bad that patients who need medical help the most, those whose lives are at risk, are being turned away. Alarmed by the plight of Poles, the Polish president wants to convene a cabinet council. But what about the government? It's not discussing the problems, and there are more and more of them. Now we learn that money from the National Recovery Plan has gone to private cardiology clinics. Is the government moving towards privatizing hospitals? Today, I took a closer look at the situation. You can count on the fingers of one hand the number of people satisfied with the state of the healthcare system. There are queues in hospitals. Specialists are unavailable. People wait for months. This year, there is no more money for treatment. You have to wait 2 to 3 months to see a specialist. No way. I've been waiting for 6 months. I made an appointment with a dermatologist in the summer. I can't get an appointment with a urologist. I got an appointment for the 5th of January. This year, there was a shortfall of 14 billion zloty, and next year, we already know that there will be another shortfall of 23 billion zloty. What's next? Patients waiting for postponed operations and sick people waiting for a diagnosis don't know. Local government officials who have to contribute to the functioning of district hospitals have no idea. Today we have to contribute 8 million zloty from the local government budget to save the hospital. This is the task of the Polish Ministry of Health. However, the National Health Fund's treasury is empty. I see these billions disappearing from the National Health Fund. This matter worries me greatly. I am considering whether to convene a cabinet meeting at the beginning of the year dedicated to the situation in the health service. We cannot leave patients on their own. This is, of course, the result of the dire state of public finances, which is reflected in all spheres of social life. So far, there has been no official announcement that the Polish Ministry of Health intends to take action. There are plans to create a project to subsidize hospitals from the medical fund, which serves patients. The economic situation looks poor. Finances are on the verge of bankruptcy, and money for healthcare has run out. Hospitals will go bankrupt. Local governments will get rid of them, and hospitals will be privatized, which is what the Civic Platform has been striving for from the beginning. The results of the latest distribution of money from the National Reconstruction Plan are a sign of the Civic Coalition's desire to privatize hospitals. The money went to private cardiology clinics. Money from the National Reconstruction Plan went to 20 private clinics. That is as much as 220 million to private chains of cardiology clinics. This raises very legitimate concerns about whether Donald Tusk's government knows which direction Polish healthcare should take. When there is not enough money for the continuing treatment of people, the Civic Coalition pays money to private entities. It also seeks savings in the salaries of doctors who save human lives. We are reaching a point where this critical mass of missing funds and patients being moved to the next year simply makes the system completely dysfunctional and inefficient. So far, the only public statement from the government on this issue, which we have been warning of for a week, is fragmentary information from interviews with the Polish Minister of Health, who is also the manager of a hospital in Pomerania and would like to close 1/3 of all facilities. We assume that 30% of hospitals in our country are surplus. This will result in fewer hospitals, and maternity wards will move to emergency rooms, where pregnant women will await the birth of their children alongside accident victims and intoxicated individuals. The government is responsible for the state of finances. What is happening today with public finances is terrifying. Time is of the essence in treating cancer patients. The government has been silent on the matter for a week.